The second part of our session from our Ravishankar sir. So I call upon Dr. Ravishankar sir to take the dais and continue with the next session of the series which we had planned today.
ಸರ್, ಈಗ ನಮ್ಮ ಪಥ್ಯದಲ್ಲಿ ಹೇಳಿರೋ ಲೆಕ್ಕದಲ್ಲಿ ಅದು ಎಲ್ಲಿಗಿಂದ ಹತ್ತಿರಕ್ಕೂ ಇವನ್ ನವಣೆ ನಾವೇನು ಹೇಳಿದ್ವಿ ಮಿಲ್ಲೆಟ್ಸ್, ದಟ್ ಈಸ್ ಆಲ್ಸೋ ನಾಟ್ ಇನ್ಕ್ಲೂಡೆಡ್ ಇನ್ ದ ಓನ್ಲಿ ದ ಪ್ರೋಟೀನ್ ಫುಡ್ಸ್ ಇನ್ಕ್ಲೂಡೆಡ್ ಇನ್ ದಟ್. ಸೊ ನಿಮ್ಮ ಒಪಿನಿಯನ್ ಏನು ಅನ್ಸುತ್ತೆ ಸರ್? ಅದು
ಆಗಲ್ಲ. ಇದು ಮಧುರ ರಸಗಳನ್ನು, ಮಧುರ ಅಮ್ಲ ಲವಣಗಳನ್ನು ಆದಷ್ಟು ಅವಾಯ್ಡ್ ಮಾಡಿ ಕಟುದಿಕ್ತ ಕಷಾಯ ರಸದ್ರವ್ಯಗಳನ್ನು ಯೂಸ್ ಮಾಡಬೇಕು ಅಂತ. ಇದು ನೀವು ಮಿಲ್ಲೆಟ್ಸ್ ಯೂಸ್ ಮಾಡಿ, ಇದು ಯೂಸ್ ಮಾಡಿ, ಯಾವುದು ಬೇಕಾದ್ರೂ ಯೂಸ್ ಮಾಡಿ, ಆದರೆ ಸಿಂಗಲ್ ರಸಗಳದ್ದು ಹಾಗೆ ಒಳ್ಳೆಯದಲ್ಲ. ಅದು ಯಾವಾಗಲೂ ಅಕಾರ್ಡಿಂಗ್ ಟು ಆಯುರ್ವೇದ ನೀವು ಅದು ಪ್ರೋಟೀನು ಫ್ಯಾಟು ಅದು ನೋಡೋ ಬದಲು ಅದು ಗುರುವ ಲಘು ಅಂತೇಳಿ ನೋಡಬೇಕು. ಪುರಾಣ ಇರುವಂಥದ್ದನ್ನೆಲ್ಲ ಯೂಸ್ ಮಾಡಲಿಕ್ಕೆ ಹೇಳಿದ್ದಾರೆ ಅವರು. ಅದರಲ್ಲಿ ಪ್ರೋಟೀನ್ಗಳನ್ನು ಸುಮಾರು ಹೇಳಿದ್ದಾರೆ ಅವರು. ಯವ, ಗೋಧೂಮ, ಇದೆಲ್ಲ ಪ್ರೋಟೀನ್ ಇರುವಂಥದ್ದೇ. ಮಿಲ್ಲೆಟ್ಸ್ ಎಲ್ಲ ಸುಮಾರು ಹೇಳಿದ್ದಾರೆ
ಸರ್. ಅದು ಕೂಡ ಬರಲ್ಲ ಸರ್. ಅದರಲ್ಲಿ ಬರುವಂಥದ್ದು ಏನಂತಂದ್ರೆ ಜಾಸ್ತಿ ಹೇಳೋರು ಪನ್ನೀರ್.
ನಾವು ಎನಲೈಸ್ ಮಾಡುವಾಗ ಆಯುರ್ವೇದದ ಕನ್ಸೆಪ್ಟ್ ಪ್ರಕಾರ ಎನಲೈಸ್ ಮಾಡಿ ಇದು ಕೊಡಬೇಕು ಅಂತ ಹೇಳೋದು. ಹಾಗೆ ಮಾಡಿದರೆ ನಿಮಗೆ ಪರ್ಮನೆಂಟಾಗಿ ಉಳಿಸ್ಲಿಕ್ಕೆ ಆಗ್ತದೆ. ಒಂದು ಪರ್ಟಿಕ್ಯುಲರ್ ಇದು ಫುಡ್ ಹ್ಯಾಬಿಟ್ ನೀವು ಮಾಡಿದರೆ ಸ್ವಲ್ಪ ಸಮಯ ಆಗುವಾಗ ಅವರು ಅದನ್ನು ಬಿಟ್ಟು ಬಿಡ್ತಾರೆ. ಅಭ್ಯಾಸ ಮಾಡೋದನ್ನು ಬಿಟ್ಟು, ಒಮ್ಮೆಗೆ ಒಳ್ಳೆ ಉತ್ಸಾಹ ಇರ್ತದೆ, ಆರಂಭ ಶೂರತನ ಇರ್ತದೆ. ಆಫ್ಟರ್ ಸಮ್ ಟೈಮ್ ದೇ ವಿಲ್ ಲೀವ್ ದಟ್ ಪಥ್ಯ. ಅದಕ್ಕೆ ನೀವು ಲೈಫ್ ಸ್ಟೈಲ್ ಚೇಂಜ್ ಮಾಡುವಾಗ ಅವರಿಗೆ ಪೇಷಂಟ್ಸಿಗೆ ಅದು ಸುಲಭವಾಗಿ ಯೂಸ್ ಆಗುವ ಹಾಗೆ ಮಾಡಬೇಕು. ಎಲ್ಲ ಫುಡ್ಗಳನ್ನು ಹೇಳಿದ್ದಾನೆ, ಅದು ಮಾತ್ರ ಪುರಾಣ ಆಗಬೇಕು ಅಂತ ಹೇಳಿದ್ದಾನೆ. ಅದು ಹಾಗೆ ಆಗುವಾಗೆ ಮಾಡಿ ಲೈಫ್ ಸ್ಟೈಲ್ ಚೇಂಜ್ ಮಾಡಿದರೆ ಡೆಫಿನೆಟ್ಲಿ ಇಟ್ ವಿಲ್ ಬಿ ಯೂಸ್ಫುಲ್. ಅದು ಅವರು ಅದೆಲ್ಲ ಈ ಪ್ರೋಗ್ರಾಮ್ಗಳು ಇದೆಲ್ಲ ಟೆಂಪರರಿ, ದ್ಯಾಟ್ ಇಸ್ ಆಲ್ ಮನಿ ಮೇಕಿಂಗ್ ಬಿಸಿನೆಸ್. ಸೊ ವಿ ಶುಡ್, ಐ ಥಿಂಕ್ ಆ್ಯಸ್ ಆ್ಯನ್ ವೈದ್ಯ ಅಂದರೆ ಕಾರ್ಯಕಾರಣ ವಿವೇಚನೆ ಮಾಡುವವರು, ವಿ ಶುಡ್ ಲೀಡ್ ಟು ದೆಮ್ ಹೌ ಟು ಡೂ, ವಾಟ್ ಟು ಡೂ, ದಟ್ಸ್ ಬೆಟರ್ ಅಂತ ಹೇಳೋದು.
ಎಸ್ ಸರ್, ಥ್ಯಾಂಕ್ ಯು.
Patient hearing morning about 2-3 hours. Now I will present the Ksharakara and Agnikarma in different conditions. Here I will tell some surgical procedures, parasurgicals, and some of the things which can be practiced as a general practitioner also, not only a Shalya specialist needed. Others also can practice. Such things also I will show. And at the same time, for Agni Karma you need Agni, for Shastra Karma you need Shastra, for Kshara Karma you need a Kshara. So how it should be prepared properly, that also I will tell. If I just tell you do Kshara Karma, where you will get the Kshara? So that also I will tell in this presentation. About 1.5 hours I think I will finish. Next please. So first I will tell about Arshas. Chaturvidu Arsha Sadhanopaya, Beshaja, Kshara, Agni and Shastra. For each procedure, next, definite indications are there. For Beshaja is internal medicine. A recently originated Arshas piles with Alpa, Linga, Dosha, Upadrava. For such things can be treated by internal medicine. Oral medicine also can be treated. You can cure such cases. You can reverse the disease with the proper pathya and nidana parivarjana with the medicines. Next please. Shastra Karma, when Tanumula Kledavan Shastrani, or next please, or a Chattara Buddha Vistritani, Kshara Sutrena Badhva, or Shastra Karmena Chitwa Dahet. When we can call it as a 4th degree piles today. Piles completely prolapsed and which is Tanumula and big Garsha, just like Chatrakara, just like umbrella, which comes out completely. In such condition should be treated with either by Shastra or by Kshara Sutrena Badhva. Both can be. This is where when the Kshara Sutra is indicated. Next please. When Mrudu Prasruta Avagada, second and third degree hemorrhoids what we call Mrudu, Prasruta and Avagada. Say big piles which Mula is broad. In such conditions, if you do Shastra or Kshara Sutra ligation, there will be big wound will be there. That is why it's a painful. In such condition, he is told to use Kshara Karma. Next please. See, previous one, back. Such one, this is for Kshara Karma. Or another thing is, if it is a bleeding one, Sravyarshas, go for Kshara. If it is Ruksha, next please. Katina karkasha sthira, a hard one. When you touch it, feel it, a piles, then that is katina. If it is mrudu prasrita, you can't feel. Such piles for kshara, you can feel it, hard, katina karkasha sthira for Agni karma. Next please. Yes, such one. Next please. So needed is ekachidra arshayantra, shalaka, amladravyas to utilize the kshara, swastigendra, pratisarani, apamarga, kshara. Next please. This is Agni karma yantra. You can use this one also for Agni karma, or you can use panchadhatu shalaka also. Make it red hot. This is very difficult in operation theatre, but this can be used with. Only thing is should be red hot probe should be there to burn it. Next please. Next. So there are three types of ksharas: mrudu, madhyama and tikshna. Madhyama and tikshna for pratisarani purpose, mrudu for internal consumption. Next please. This is kshara, a prepared kshara. Next please. Next. Next. So then procedure of kshara karma, you will show the procedure. Lithotam position, anesthesia given. At the time of Sushruta, madhya is being used. Then with the latest technology, we are using, first used ether, then nitrous oxide, halothane, this isoxane, many drugs are used. Without anesthesia, today you can't think of shalya karma. All zeros are surgery without anesthesia. If anesthetist is there, one anesthetist is there, all we zeros have value. Otherwise, there is no value for us. So always there should be one anesthetist should be there behind us. Then we have the values. So you can't think of surgery without anesthesia. It may be local, spinal or general, anything. Next please. So first lithotam vision, first under anesthesia, you can do 4-finger dilatation or a sphincterotomy can be done, so that post-operative pain will be considerably reduced. You are not cutting anything, just you dilating it. 4-finger dilatation. Next please. Next. Then Gratabhyaktam Gudamava Yantram Rugam Payo Shane Shane Pravamanasya Pranidhaya. Then proctoscope should be entered into the anal canal. Next please. Now you are using xylocaine jelly abhyakta proctoscope or Gratabhyakta. Both you can do. Procedure as told in Sushruta we are practicing. You don't think it is something different. So many procedures are as explained nicely. Next please. There is no difference. Pravishtocha arsho vikshya. Next please. Then posterior part of the arsho yantra should be blocked. Next please. Chalakayo utpidya. Next please. Should be blocked, posterior part blocked. Then pile mass should be brought into the proctoscopic canal. Next please. Next. Pichu astra yantram pramrujya. In the pichu astra should be cleansed. Next please. Ksharam patayate. Kshara patana should be done. Next please. Kshara patana should be done. It should be applied. How much it should be applied? It should be applied up to thickness of naka utsedra. How much thick your naka is there, that much thick you should apply. That is the dosage of kshara. Next please. Patayitva yantradvaram panina pidhaya. In your hand it should be closed. Next please. Vakshata matra upaksheta. You are closing it to prevent burning of the arshas by kshara. If you open it, environmental temperature and humidity may disturb the pachana of the arshas by kshara. For that you are closing it. Next please. Then you should wait for shatamatra kala. Shatamatra kala means approximately 35 to 40 seconds. One matra kala, once you close and open your eyes, like that you can count 100 counts. That is about 35 40 seconds. Then it should be washed with the amla dravya. Dadimastu shukta. Shukta is a vinegar or phalamla. Phalamla is lemon juice. Any this one can be used. Next please. Should be washed. Should be washed with the lemon juice, anything, to neutralize the kshara. Next please. Next please. Pakwa jambu pratikasha. When samyak dagda arshas will be pakwa jambu phala varna. Next please. It is just like jamun fruit. Pakwa jambu phala varna. You see there is many jamu fruits, 2 jamu fruits inside. It's a very beautiful simile given by Sushruta. Evam sapna upakrameta. Here, if when multiple arshas is there, First one arsha should be done, then after 1 week another, after 1 week another should be done. This is what Sushruta said. In today with the advanced anesthesia, advanced analgesics, we are doing all the arshas at a time. It can be done. So that is why I am showing. Next please. If you are not well versed with this kriya, you can do 1 pile at a time, after a week another, like that also it can be done. But with the advanced experience, you can do all piles in single sitting also can be done. So another arshas, next please. Then apply the kshara. Again same procedure. Wait for Shatamatra Kala, do this one. Okay, next please. At 3 o'clock. Like that it should be continued. Wait for Shatamatra Kala. It will become Pakkvajambu Phala Varna. Then it is, you clean it with the Amla Dravya. It's all now finished. Next please. Vyadibalam Ksharabalam Vikshya Puna Alayapayat. Next please. Savashesham Punah Dahayat. If, next. If once you applied, if it is not burned completely, slight parties, if Vyadibala is more or your Ksharabala is less, it will not burn completely at a single application. Punah Alayapayat. Again you can do procedure. Then itself after washing you see, it is not burnt, again you apply. Once applied means should be Shatamatra Kala. Some brilliant persons what to do, instead of doing it twice, apply for 10 minutes. Finished. Like that it should not be done. If you do, what happens? Kshara may enter into the muscle tissue, Guda Dalana occurs, incontinence may occur. That is why you should be very careful. So once applied means it should be Shatamatra Kala. You wash it, again apply. If you want, again you apply. But once applied means Shatamatra. It is very, very potent medicine. You should be very careful. That is why I am saying. Just burn ಆಗಲಿಲ್ಲ ಹಾಗಾದ್ರೆ ಒಂದು 2 ಮಿನಿಟ್ ಹಚ್ಚಿಬಿಡು ಅಂತ ಹಾಗೆ ಮಾಡಬೇಡಿ. Don't do like that. So it will harm the patient muscles. Next page. Again we are doing the procedure. You see, Mrudu Prasruta Avagada. Yes, same person, when Katina Karkasha Sthira is there, we are doing Agni Karma. You may think I am cutting with the Agni. Actually it is not cutting. Agni is 4 types. Bindu, Vileka, Tresra, Pratisaranya. This is Pratisaranya type of Agni Karma. You are burning completely. You see, this is done by Kshara, this is done by Agni. Where Mrudu Prasruta Avagada is there, then we are doing Kshara Karma. Where Katina Karkasha Sthira is there, there is Agni. Same person, same time may have both Vata Kaphaja and Pitta Raktaja. Where Pitta Raktaja is there you do Kshara. Where Vata Kaphaja is there you do Agni. Where Ruksha is there is a Agni. Where Sravi is there, where bleeding occurs, there you do Kshara. So that is why we are saying Avastha Vasham Chikitsa Kuryat, or according to presentation. If presentation of Pitta is there, Kshara. Presentation of Vata Kapha is there, Agni. That vice versa we should not do. Then sphincterotomy can be done, so post-operatively if needed. Otherwise no need of doing this procedure. Next please. Next. Then pack is done. Then with the Madhuragana Aushadhi Taila. Then send patient to operation, post-operative ward. Next please. With the Madhuragana Aushadhi. Next please. So now post-operative treatment, Paschat Karma. That pack has to be removed after 2 hours. Then Narayana Sarivai Taila. Any Madhuragana Aushadhi Taila, Basti should be given. Matra Basti is 40 ml. No? You are using only 3 ml, 5 ml. This is known as Rana Basti. Known as Rana Basti. It is in Ashtanga Hridaya. In first year BMS you learn it. Okay, Rana Basti. Then hot sits hip bath. That is Ushnodaka Avagaha Sweda. Why you are doing Ushnodaka Avagaha Sweda? Why can't you give Tapa Sweda? There are 4 types of Sweda is there. No? Tapa, Upanaha, Ushma Sweda, Drava Sweda. Why it is told 4 types? Only 1 is sufficient. This is also told according to dosha only. When Kevala Vata is there, you give Upanaha Sweda. When Pitta Samsarga is there, you give Drava Sweda. When Kapha Samsarga is there, you give Tapa Sweda or Ushma Sweda. Why is not told in textbook? This much told in textbook. All Sweda for Vata dosha. If it is Kevala Vata, he says to give Upanaha Sweda. If it is Pitta Samsarga, he says to give Drava Sweda. Pitta is made up of Agni and Jala. Agni and Jala. In such conditions, if you give Tapasveda or Ushmasveda, what happens? Jaliya amsha of Pitta will reduce, Agni amsha increases. Instead of decreasing pain, it will increase. That is why whenever there is a Pitta Samsargaja Vata is there, you have to give Dravasveda. That is, you are giving Katibasti, Parisheka, all these things, Vedas you are giving. When there is a Kapha Samsarga is there, Kleda has to be removed. That is why you are using Tapasveda or Ushmasveda. When Kevala Vata is there, you are taking Upanahasveda. Why? Upanahasveda means it contains Yava, Godhum, etc. basic dravyas. To that you add Amla Dravya, Lavana, Gandha Dravyas and Taila. Make it payasa first, boil it, make it upma, then it should be spread over cloth, then you are doing bandhana. Why you are doing bandhana? Why you are doing bandhana? Vayu has a chalanatmaka guna. If you just apply it, vayu udhar se bhag jayega. Usko pakad ke amapachan karo. Usko, that is why you are doing bandhana. That is Upanahasveda for Kevala Vata. I hope you understood. So everything on basis of Karyakarana Vivechana, Karyakarana Siddhanta. That is Ayurveda. I hope you understood. So dosha should be analyzed whichever treatment you are giving. That simply you are not giving Sveda. For every treatment there should be dosha analysis should be done. So here it is Pitta Samsargaja Vata, that is why we are using Dravasveda. This is Agni Karma, Kshara Karma, Shastra Karma, all Pitta Samsarga. Mild like that, Gandha, then you are doing Runa Chikitsa. Arshas Chikitsa. Arshas is gone. Then Runa Chikitsa should be done. Next please. Post-operative complications. Bleeding. Bleeding may be there. Primary, reactionary, primary and secondary bleeding. Whatever bleeding is there, bleeding point has to be find out, it has to be ligated. That is the treatment. Sometimes it may happen. Pain is a subjective symptom. Some person will not have pain at all. Some person have very severe pain. That is according to person's sensitivity. That's what happens. Discharge. There will blackish brown discharge for 4 to 5 days. Stricture formation should not happen. If it happens, it is a mistake of a surgeon. If you apply all around, there is a chance of stricture. It should not happen. Recurrence. At the area where we do Kshara Karma, there is no recurrence. But other arshas, secondary arshas can happen if a patient takes the same Nidana Sevan. Next, Brashtagudha arshas. When Brashtagudha arshas is there, Vina Yantrena Kshara Karma Kuruyita. Without Yantra, you can do. This is not 4th degree piles, it is a inflamed piles, Brashtagudha arshas. Next please. It is actually piles only this much, it is inflamed, that is why Brashtagudha came out. Applying the Kshara, again same procedure is same, apply all around. In between we should not apply the Kshara. Healthy tissue should not apply the Kshara. Next, you wash it, it becomes Pakka Jambu Phala, Varna in Shatamatra Kala. If any remaining is there, Savashesham Pudadahete, again you are applying the Kshara. At a single time you can apply all 3 pile mass. In between I don't apply, only apply the pile mass. So in between should not apply. If you apply all around, there is a chance of stricture. So after a week, patient become all right. All the regress, it will falls off. So how this Kshara Karma works? Next please. So what is the thing? A cherry fruit like arshas, after applying white Kshara, it becomes jamun fruit in 35 seconds. Cherry fruit is converted into jamun fruit. How and why? In 35 seconds. You are saying Ayurveda is slow. Is it slow? Ayurveda has such a potent drug which can be done very fast. Don't think it is slow. Next please. See, it works by 2 means, mechanism. One is, it cauterizes the pile. This cauterization, burning, it can be done in a calcium hydroxide or sodium hydroxide you prepare in the lab. Any alkali you prepare, that also burn that one. But this action occurs only due to Ayurveda Kshara. What happens? Once you apply this Pratisharanya Kshara, it enters into the pile mass. There is a plenty of blood is there. All proteins are coagulated. Protein coagulation means heme and globulin is disintegrated and globulins are coagulated. That heme gives you Pakko Jambu Phala Varna. Heme gives you Pakko Jambu Phala Varna. Since it is a plenty of blood is there, that is why Jamu foot color comes. If you apply to other healthy area in the rectum, it will not become Pakwajam Phalavarana because that plenty of blood will not be there. It will become just bluish color, not Pakwajam Phalavarana. It occurs only when plenty of blood is there. That occurs in the hemorrhoids. Then disintegrate, reduce in size, decrease in size, and necrosis and scar formation, permanent obliteration of hemorrhoidal vein occurs. This is how it works. Which one? Kshara karma works. Next, please. So after 7 days, just you see after 30 days what happens. This is proctoscopic view. After 30 days, just you see, it's almost all bile mass gone. A healthy anal canal is formed. You can see all bile mass has gone. In a proctoscopic view, see, just a linear scar is there. All bile mass gone and linear scar, just a line. You can see. See, just a big bile mass gone, just a linear scar and healthy tissues. Just 30-35 days it happens with the Kshara karma. This result you can get in all bile masses. So Agni karma is burning the tissue. That's why I have already shown you. Next, please. Next, I have shown you already. Next. So advantage, minimum hospitalization, less pain, recurrence less, cost also very less. Next, please. So, okay, next, please. Next. Now, how this Kshara is prepared? This is very important because everyone should know how it can be prepared. Because in market what Kshara you get, that is for Paniya purpose, not Pratyaranya purpose. If you apply that Kshara, it will not work. So, it should be a Mrudu Madhyama Kshara. Next, please. Tikshna Kshara. Take well dried plant. Here I have taken Apamarga plant and 10 kg of plant is taken. It should be well dried. Then it should be burnt. If you take 10 kg of plant, if you burn it, it will become 1 kg of ash. So it should be well burnt, well dried plant. If it just slight wet plant, if you burn, what happens? It becomes coal instead of ash. Next, please. Like they have 27 drugs, Sushruta has told. If coal, if it becomes coal, if you prepare Kshara out of it, what happens? Coal is a best buffering agent. You are preparing alkali. So that coal itself buffers the alkali. The potency of Kshara will be reduced. That is why it should be well burnt till it becomes ash. That's very important. Next, please. Pashanti Ekdam Basmam. Next, please. That Basma has to be taken. Next, please. Then Kshara Drona Udakana should be alodia. If 1 drona of Kshara, 6 drona of water should be added. Next, please. So 10 kg plant if you burn, it becomes 1 kg ash. For 1 kg ash, you think how much water should be added? That is why I am saying it is not correct. It is a volumetric. 1 kg ash means it becomes 3 liters of ash. In volume it is 3 liters. If you want to add 6 liters water, you can't filter anything. You can't get correct proper Kshara. For 3 liters of ash, you should add 18 liters of water. 6 times in volume, not in weight. So, next please. Then alodia should be mixed properly. Then it should be filtered for 21 times. Parisravya eka vimshati krutva. 21 times should be filtered. This filtration, one time filtration, 1 day you can do, next day like that 21 days also you can do. Or single day itself you can filter for 21 times. But it should be filtered for 21 times. Doctor came and asked me if I make 5 layers, like 4 times finished. No, that is not correct. One filtering means only once. Maybe 4 layers or 8 layers, 10 layers. Then 21 layers you make 1 times. That is not possible. Should not do. Once you should filter 21 times means 21 times should be filtered. Next clip. Next bit. As you go on filtering it, slowly it becomes clearer solution. Next please. It becomes very clear solution now. It will become just like Gomutra. Even just you add only water, it becomes just like Gomutra. You can utilize instead of water, you can use Gomutra also for preparation of the Kshara. Gomutra or Jala, anything you can take. Then now 21 times finished. Next please. Then it should be mounted on a fire, should be boiled, vipachet. How much boil it? 1/3 of water should be reduced. 2/3 bachega. That is, then you filter it, that is paniya kshara. That can be say mrudu kshara, that can be used for paniya purpose. So a paniya kshara can be utilized according to virya of the dravya. A yavakshara is shita virya dravya, a chitraka kshara is ushna virya dravya, like that it works in the patient's treatment. But for pratisaranya purpose, any kshara, it works as pratisaranya. Next please. Then make it madhyama kshara, add katahara, basma shakara, shankanabi, any limestone should be taken into red hot. Next please. Make it red hot. Heat it till it becomes red hot. At the same time, in another vessel, this is boiling. Here it will be red hot. Then this boiling kshara jala should be added to this red hot limestone. Next please. What happens? About 1.5 kudava. Next please. Should be added. By adding this boiling kshara jala, shukti becomes paste. Pishta, it becomes pishta, then that is madhyama kshara, that can be used for pratisaranya purpose. For making it till tikshna, you should add prativapa dravyas. This is known as avapa procedure. Here again should be filtered after making this pishta, then it should be filtered again, then it should be utilized. Next please. Again it should be added and boiled. Another 1/3 should be reduced. Then to make it tikshna kshara, you should add some prativapa dravyas like chitraka, danti, langali, etc. You boil it. Danti, dravanti, chitraka, langali, putika, pravala, chitraka, vida, suvarchika, kanaka, kshiri, hingu, vacha, ativishaha, samashlapana, shukti pramana. All these things drugs in together, taken shukti pramana should be added. That is a pratisaranya purpose. Next please. Here I have taken, you can take single drug or all the drugs together. Usually I take chitraka plant or langali. It should be made khalka, gandha khalka should be added. Next please. After adding this one, that will become pratisaranya kshara. Next please. Tikshna kshara. Again it should be boiled till it become nati drava, nati sandra. Like dosa hittu, idli hittu. That much it should happen. Next. Then it should be, next please. It should become just like this. Nati drava, nati sandra. If you dry it completely, it loses potency. There should be a layer of kshara jala should be there. Then it should be collected in a samruddha mukha kumbha, kept in dhanya garbha for 1 week. Then it should be used for pratisaranya purpose, for the procedure. Next please. Dhanya garbha should be kept in dhanya garbha. It settles down. There will be a layer of kshara jala over kshara. As time passed on, if kshara jala reduced, dried up, it loses its potency. To make it potent again, if you add kshara jala, you can make it potent. But there should be a layer of kshara jala always. Then you can use for any length of time, even 10 years, 15 years, but kshara jala should be there. So to conclude, if you take 10 kg of plant, burn it, it becomes 1 kg. 1 kg add 6 times of water, solute, remove, boil it. Next please. To that add 100 grams of shukti. For 1 kg ash, take 100 grams shukti. Then boil 10 grams of chitraka. 1:10:100. 1 kg ash, 100 grams shukti, 10 grams chitraka, langali, etc. This is the ratio. Like that you prepare. Then it should be nati drava, nati sandra. That is also very important. It should not become dry. Then it loses its potency. It is very important. Then you can use it for the procedure. Next please. So same pratisaranya kshara can be used with bhagandhara, pulmonary sinus, carcinoma in situ, non-healing ulcers, rectal prolapse, tonsillitis, skin diseases, nasal conditions. All these things you can utilize. Next please. I will show you some of the cases. Here it is in fistula. What I do is, fistula occurs due to inner glands in the intersphincteric space. That area, in space area, I make a opening and window, I put the kshara in that area. So when the glands are burnt completely, the mula srotas of bhagandhara is completely burnt with the kshara. then no need of applying Kshara Sutra or other area. Only Kshara Sutra applied only in between internal sphincter and skin area, not other area. Next, then washed with the lemon juice. Then put the Kshara Sutra only for here, this area left out. It will heal by itself because more srotas is burnt completely. Whenever there is a posterior horseshoe shaped fistula, this procedure can be done, not in all other cases. Some of the cases we can do. Next please. See, after 1 week, see, it regressed. This completely regressed, it will heal completely. That also, after 5 weeks, completely healed. You see, it regressed and healed. Fistula is healed without the Kshara Sutra, with utilizing Kshara. This is the advantage. Fast you can treat and 100% cure can be given. Next please. It is in the pilonidal sinus. You do excision and put the Kshara. Chitva dahet kshareda agnina va. Next please. Nadiruna. Next. First you do excision. Next. Do next. Chitva dahet agnina ksharena. Then apply Kshara. If you apply Kshara, whatever small its branches are there, it's all burnt with the Kshara and it will heal. So, you may think there will be severe pain. Absolutely, it is a painless. There is no pain at all. Patient will not have pain post-operatively. Next, please. Apply the Kshara. Again for Shatamatra Kala. Then wash with the vinegar or lemon juice like that. Then pack. In rectal flaps, next please. What happens? Flaps is it will put inside. In dentate line, 1 inch above and below, apply the Kshara all around. Since very broad anal canal will be there, you are making a stricture so that prolapse is prevented. Next please. Next. Sit resistant. Next. Here you see, applying the Kshara. After that is restricted. Then I put the This procedure like this so that it will not prolapse and the stricture is formed. Next prolapse will be stopped. Next please. You can see after a week it is patient came with the complete healing of the rectal prolapse. Such a big presidency also can be treated. Next please. It's a procedure. Next please. Go for next. Next. Yes. This is for tonsillitis. Just you see it's a self-explanatory. Patient himself is a Ayurveda surgeon. He had tonsils. All babies above 6 years, if patient allows, you can do this procedure. But without having skill, don't do it by seeing the video, because Kshara may spill into trachea. There is chances of tracheal spasm. It's a very dangerous area. So if you have a skill, it can be done in OPD also. That should be washed with the lemon juice or takra you can use. But this can be done in OPD. No need of admission, all these things. In OPD it can be done. Here Kshara is applied not in Darvi yantra, it is applied with the cotton peeler. So that jelly amsha of Kshara is absorbed into Kshara absorbed and Kshara can be applied. So it will not spill into the trachea. So I am applying the Kshara. Wait for Shatamatra, then wash it. Finally buttermilk is given for gargling and drinking. See, it is after, on second day, you can see. So on third day, reduced, and on fifth day, it is completely cured. So simple procedure, I think can be done in OPD also. Here it is a nasal hypertrophy, see, hypertrophy. Apply the Kshara, after 1 week, it's completely reduced. Many patients of Pratishaya comes with the nasal hypertrophy, with the sinusitis all. The sinusitis is hypertrophy. Just apply Kshara, apply it, after 1 week, completely reduced. Next please. Applied Kshara, his circulation becomes all right. It's a very simple procedure. It can be done OPD. Just apply slight 1 ml of xylocaine, this one, so injection, not giving injection, just spray it. Then it becomes painless area. Apply the kshara, in 1 week it goes. Just within a, by shatamatra kala, it goes off. In OPD it can be done. So, other OPD level management, I think you understood this kshara karma in nasal hypertrophy. Now coming to some energetic disorders with the OPD level management, some of the diseases, simple. Next please. One, why they come to us, a hemorrhoids patient, they come to us, next please. They comes to us, either there is a mass, or there is a bleeding, or there is a pain. In these 3 conditions they come to us, most of the patients. If just bleeding is there, without pain, they don't come. They do all the medicines, then severe is they come. If pain is there, first they will run to you, if pain is there. If mass is there, they will wait. If pain is there, immediately they come. So when are the things happens? Bleeding with the pain, it may fistula in ano, fissure, thrombosed piles, malignancy. Bleeding without pain, internal hemorrhoids, Crohn's disease, ulcerative colitis, malignancy. How you will diagnose? You take a glove, put into your hand, just to see what it is, the condition. So all the physician should do it. Then you can diagnose what it is. According should be treated. Next please. Mass per rectum conditions with the pain. When thrombosed piles, only piles, usually it is a without pain, but mass with the pain, that means there will be thrombosed. Malignancy, fistula sepsis, sentinel tag with the fissure in it. Mass per rectum condition without pain. There is no pain but mass. Rectal collapse, malignancy, hemorrhoids. Next please. Internal piles, next please. It is just engorgement will be there, this internal hemorrhoids. Since engorgement from, it is a insensitive area, that is why there will not be any pain. That is why they come without pain. Next please. While you treat a painless bleeding, no mass feeling, first degree, second degree there will be prolapse, third degree prolapse, it will go inside, you put inside, it will be there. In 4th degree, even if you put, it will come outside. So all things you can diagnose. Next please. Treatment. Your treatment will be, first thing is to stop the bleeding. Stop the bleeding means Rakta Pitta Vat Chikitsa. For Rakta Pitta, Pitta can be tackled by Madhura Gana Aushadhi, Tikta Aushadhi, Kashaya Rasadravya. Madhura, Kashaya, Tikta. Right. If it is Kevala Pitta, you should use only Kashaya Dravya. If it is Vata Samsarga Pitta, then you give Madhura Gana Aushadhi, Gritas. If it is Kapha Samsarga, Tikta Rasadravya should be given. So just bleeding, you are not giving a single drug. According to dosha vivechana, should be done again. Sometimes patient, how you will diagnose? If it is a kevala pitta, severe bleeding will be there. Give kashaya rasadravya. Ashoka kashaya churna you can give. Asana kashaya you give. Lajjalo kashaya you can give. Or pushya anugu churna you can give. These things. When it is vata samsarga, this is not sufficient. Madhura Gana Aushadhi Grita, Shatavari Adigrita, Shatavari Kshira Kashaya should be given. If it is Kapha Samsarga, Madhura Gana Aushadhi Shatavari will not happen, useful. There you have to use Tikta Rasa. Which one? Kutaja Ganavati, Kutaja Kashaya, Kutaja Grita, these things. I hope you understood. What happens? See, bleeding, I tell you give Ashoka Kashaya. From tomorrow you give Ashoka Kashaya for everybody. Some patient you get result, some patient don't get result. If it is Vata Samsarga or Pitta Samsarga, Kevala Pitta, it will be useful. That is why you should diagnose. This is Vata Samsarga, Kapha. How will you diagnose? Pittaja, severe bleeding. When Kapha Samsarga, Granthivat. If it is Vata Samsarga, less bleeding due to Ruksha Guna of Vayu. Less bleeding will be there. May not be painful or may be painful, but less bleeding will be there. Then you have to give Madhura Gana Aushadhi, Gritas, like a Shatavarya Grita. I hope you understood. Should diagnose it according to dosha and give a drug. Then Ushirasava Kanmukta is to reduce the mass. One is stop bleeding, reduce the mass. Haritaki, Kshara Karma, Shastra Karma should be done. Next please. The external pile mass. Next please. Here external hemorrhoidal mass, previous one. It may increase in size, engorge. It is painless. Next, please. For this symptom, mass feeling will be there. Treatment will be Haritaki or Agni Karma should be done. Other drugs, Triphala, Gugul, all these things. If it is thrombose, it will be useful. Otherwise, no medicine will help you. If external piles, it is a painless condition. If pain occurs, that is thrombose. Then you can give Triphala, Gugulu, Haritaki, etc. And sits bath, all these things. Next, please. Internal thrombosed pile mass. Next, please. If a pile mass engorged, if it is thrombosed, then mass feeling will be there. If you put the finger, you will feel the mass with the severe pain. Next, please. Then the treatment will be, you can do prachanna karma. Take a needle and prick it. The clots will be removed. But you should be very careful. There are chances of continuous bleeding. Then it has to be ligated. So it should be careful. Otherwise, you can give internal medicine. Jatiya Taila for application. Give him sits bath. Slowly that clot will be reduced by itself. It will heal. Instead of medicine you give, very important, just apply oil, give him sits bath, that thrombosed pile mass will reduce and pain also reduce. By 1 month it will heal completely. Or you can put jaloka, all these things can be done. But there is chances of bleeding. Then it has to be ligated. But this is very easy. Give him sits bath, applying oil. That is Ushnodaka Vagasveda. And Gandhaka Rasayana, Triphala Gugulu, Chandraprabha, Kamadvid Mukta, Abhayarishta, these things can be given. I say Runa Shota Chikitsa. Next, please. External thrombosed piles. Next, please. This external pile may be thrombosed. This is plenty of patient comes to you in a clinic. They come with the external mass, severe pain, all this. It's very pain. That much not painful. It's a very severe painful condition. External thrombosed piles. Next, please. Pain very severe and mass feeling is there. They come running to you. Severe pain is there. Doctor Ushna agide ishtu doddu bokke untu novu untu. You can do prachanna karma. Take a needle and prick it, or you can put the jaloka. That also can be. There is no chance of that much bleeding in this condition. But internal medicine, by medicine itself, it can be cured within 15 days. Just apply Jatya Tela, give him sits bath, Gandhaka Rasayana, Triphala Gugulu, Chandraprabha, Kamadvid Mukta, or Arogyavardhini, these things can be given. Slowly it will reduce in size. It's a pain, everything. Within 2 days they tell you, it is gone. Slowly it will come down. This very easily can be practiced. Most of the patients come with this condition. External piles with the thrombosis. Many of the patients. Actually it is not that much serious condition. Next, please. Fistulous abscess. Next. See, there may be abscess in perianal region or internal region. When abscess is internally, there is no much pain at all. Patient may come with slight fever, but condition may be very serious. But when it occurs here, perianal area, there is for engorgement, there is no much space. That is, it is very painful. They come to running to you, very severe painful. It is very easily done. IND should be done. First should be removed. That can be done. Next, please. Next, fistula sena. This abscess rupture here and there is chances of fistula can be occur. Next, please. For this is not conservative managed condition. It should be done by Kshara Sutra or surgical repair. Next, please. Next, please. Sentinel attack with when fissure. It's a runa, dushta runa. Due to it's a sensitive area, but there is involuntary muscle is there. Since in sensitive area involuntary muscle is there, immediately after fissure, this involuntary muscle not in your control, that will be spasm. Spasm of the internal sphincters, that gives a very severe painful condition. But this external sphincter, it is in your control. You can relax it to pass the motion, but it is not in your control. It will not be relaxed. There will be very severe pain. When the next motion comes, patient feels very severe pain. It's a continuous process occurs. Next, please. So that very severe pain. This area is sensitive area. In sensitive area, involuntary muscle is there. That is a very painful condition. Next, please. So, usually this is known as parikartika. We call it as parikartika. Actually, this condition is explained in Sushruta Samhita, Atisaradhyaya, where he says, Shakritaya samsrishtam atisarya shonitam pak paschadya purisham sa ruk sa parikartikaha. Parikartika means parikarta basti gudam edreshu parikartanimiva vata vedana. Very severe pain, vata vedana occurs, basti gudam edreshu. Such condition occurs in this with the bleeding. So this condition itself is called as parikartika. Actually it comes under the heading of Raktatisara in the Sushruta Samhita. Next please. The another condition is parikartina vata vedana, varchaso ativibandha. When the hard stool is there, there is a parikartanavat vata vedana. In purisha avarana vata. Then also parikartika can occur. Next please. So here, severe pain in anal region, that means vata dosha prakopa. How it occurs? Due to injury. The olden days, patients used to sit for defecation in outer fields. There is a external injury can happen. That also can cause, or by hard stool also injury can occur, or varchasa vibandha, ati vibandha, purisha avaranat vata prakopa can also occur. This everyone can understand. My question is, how it occurs in atisara, virechana, basti upadrava? Basti netra upadrava, due to injury. How it occurs in loose motion is there, atisara, virechana and basti upadrava. How it can occur? In loose motion also it will occur. Why? No, not by rashes. It will occur then, that day itself it occurs immediately. Why? By that what happens? Why? Because vata prakopa is there, you know. Vata prakopa can occur dhatukshayat margasya avaranena cha. Here dhatukshayat vata prakopa, that is why parikartikavat vata vedana occurs. Whereas in this condition, avaranat vata prakopa, in this condition it is dhatukshayat vata prakopa. I hope you understood. Because of dhatukshaya also, there is a chances of, because spasm occurs. Spasm means avaranat vata prakopa. Or dhatukshayat vata prakopa, there will be spasm. For vata prakopa should occur. It is occurs due to dhatukshayat vata prakopa. Next please. So, dhatukshaya and margavarana, dhatukshaya, atisara and virechana upadrava causes vata prakopa. Next please. This number one is abhigata raktush raktavanata prakopa, that is avaranat, then causing the vruna. Next please. Here you understood vata dosha prakopa, precursor is either dhatukshaya or margavarana. In this area, two types of vayu is there. One is apana vayu and one is vyana vayu. Apana vayu work is pravahana, vyana vayu work is prasarana and akunchana. When vyana vayu becomes powerful, vyanavrita apana occurs. Vyanavrita apana, what happens? Next please. Vyanavrita apana. Vami admana udavarta gulma arti parikartikaha lingam vyanavrita apani. Vyanavrita apana, you get? Vami admana, it occurs in all colicky conditions. Uterine colic, ureteric colic, biliary colic, intestine colic, all these conditions, vami, vomiting, admana, udavarta, shula, arti. In anal region there will be parikartika. For to happen, that is a parasparavana. To happen that, there should be vata prakopa. That vata prakopa will occur due to either by raktavarana vata prakopa, by abhigata, or by dhatukshayat vata prakopa. So initial pathogen, that is samuthana vishesha I am explaining. Either by dhatukshayat vata prakopa or avaranat vata prakopa. Like this prakopita vata, there will be paraspara avaran of vyanavrtapana will occur. While treating, by that what happens? It is very important thing is because, next please. While treating such condition, if it for vyanavrtapana, snigdhanulomana you give. Snigdhanulomana. You give aipatikara churna with dugdha, abhaya arishta with grita, yeranda taila with the grita, haritaki with the grita, snigdha anulomana you give, vyanavrtapana goes. But parikarti will not cure. For that, vrunashota chikissa should be done. And if very severe is there, you can do Agni karma. Next please. Sushruta says, Togam shirastaya atyugra rujivayo uchrita katina supta mamse. Uchrita mamsa, if supta runa is there, what you have to do? Agni karma. That is nothing but Vruna Granthi. Next, it is nothing but sentinel pile with the fissure in nena. You see, Uchrita Mamsa, Suptarvana. Uchrita Mamsa, Suptarvana. That is fissure in nena with the sentinel tag. That is actually a Vruna Granthi. Usually we call this as Arshas. That is not Arshas. That is a Dushtarvana with the Vruna Granthi. It should be done by Agni Garments, what Sushruta told. Next, please, rectal prolapse. Next, that is I have told you already. Next, malignancy. Next, malignancy can occur. It's a treatment. Shastra, Kshara, Agni, Beshaja is told. If surgically it can be removed, first you do the surgery, then Shamana Aushadhi should be given. Otherwise, Kshara and Agni Karma can be done. And Beshaja Chikitsa. Beshaja Chikitsa is next, please. Rakshet balam chapter narasya nityam tad rakshitam vyadi balam nihanti. It is told in Arbuda Adhyaya by Sushruta himself. If you do rakshana of the bala of the patient, that rakshita bala nihanti vyadi bala. It is now it is developed as immunotherapy in modern system of medicine. It is being developed a modern treatment protocol. It's what Sushruta has told for Arbuda Chikitsa. Next, please. Many drugs are there. Hypertrophied anal papilla. Next, please. There may be hypertrophied anal papilla. Due this anal papilla, when motion comes, it will not dilate properly. Usually there is a formation of fissure in anal. Abhigata rupture occurs. Next, please. See, this anal papilla. The Chikitsa is Agni Karma should be done. By medicine, it cannot be removed at any cost. Next, please. Crohn's disease and ulcers. Next, please. And ulcerative colitis. See, what is the difference between Crohn's disease and ulcerative colitis? In both conditions, there will be bleeding with the mucus. In piles, only bleeding, there is no mucus. Here, mucus with the bleeding, mucus stool with the blood will be there. So, difference between ulcerative colitis and Crohn's is slightly serious condition. It will occur even in the small intestine also, whereas ulcerative colitis occurs only in the large intestine. And another thing is, in Crohn's disease, it will go into serous layer. Perforation of the intestine chances are more in Crohn's disease. Whereas in ulcerative colitis, there is no such chances. It will be only in the mucosal, submucosal layer. Ulcers will be there. The Shamana Aushadhi, next please. Previous one. Yeah. Shamana Aushadhi, what I suggest is, it is a Prabhuta Amayukta Raktatisara. It should be treated as Raktatisara, not as Grahani. In the Grahani, usually many of them compare it to the Grahani. In a Grahani, basic symptom is Muhur Baddha Muhur Drava. In this, there is no Muhur Baddha Muhur Drava. Always loose stool with the mucus. When you take milk, it will increase. So it is a Prabhuta Ama with the Raktatisara. It may be Sannipataja Raktatisara. Chikitsa, what I suggest is, I give Yashti Madhu and Musta with the plain Kashaya. If you give it continuously, immediately it's controlled. If needed, what I do is, I give Sadhyo Mana and Sadhyo Virechana. Immediately it reduces. After, if still it is not controlled, you can give Pichabasti. Then all the ulcers will heal. Even after doing Pichabasti, I have seen some cases, by doing colonoscopy, all ulcers will heal completely. So, Pichabasti, it's an excellent treatment for such condition. In very severe. Most of the diseases are controlled with just with the Yashti Madhu and Musta, plain kasha. Without milk should not be given to the patient. Pathya is very important. Milk, basale, bende, moong dal, these things they should not eat at all. Or chicken, fish, this should be avoided. And take this one, Yashti Madhu and Musta, plain kashaya. Usually in this Shamana Aushadhi itself is controlled. Still it is more. Give Sadhyo Virechana. Still not cured. Give Pichabasti. In these things it can be controlled. Then continuously you give Shamana Aushadhi for about 6 months or 1 year. Even patient comes with mesocol, you give this treatment slowly, we can withdraw the mesocol. Sometimes patient freshly come to us without mesocol also, we can treat without steroid also. So it's all according to presentation, you should adopt the treatment protocol. Next please. Sir, drugs used. Next please. Next. So, Satata Adhyanam, Vadaha, ಪರತಂತ್ರ ಅವಲೋಕನಂ ತದ್ವಿದ್ಯಾಚಾರ ಸೇವಾ ಚ ಬುದ್ಧಿಮೇಧಾ ಕರೋ ಗಣಃ. ಸೊ ಆಲ್ ಆರ್ ಸೈಂಟಿಸ್ಟ್ಸ್. ಸತತ ಅಧ್ಯಯನ, ವಾದ ಆ್ಯಂಡ್ ಪರತಂತ್ರ. ಐ ಆಮ್ ಹ್ಯಾಪಿ ದಟ್ ಹಿಯರ್ ಇನ್ ಶಿವಮೊಗ್ಗ ದೇ ಆರ್ ಡೂಯಿಂಗ್ ವಾದ ಆ್ಯಂಡ್ ಪರತಂತ್ರ ಅವಲೋಕನ, ಪರಸ್ಪರ ವಾದ, discussion, having a discussion, a forum you have made, and your learning process will improve. Actually it is a Ayurveda way of research. You will develop different protocol for different conditions and have a successful practice. Wish you all the best. Thank you very much for giving this opportunity.
Prashok Shara. 1 kilogram means 3 liters. So what is that calculation, sir? How
No, that I have practically have seen, that's what I am saying.
Okay.
If you make a basma, if you weigh it, it will become 1 kilo. To make it in the volume, if you see, ಅಳತೆ ಮಾಡಿದರೆ it becomes 3 liters. ಅಷ್ಟೇ, ಮತ್ತೆಂತ ಇಲ್ಲ. ಅದು 2 ಲೀಟರ್ ಅಂದರೆ 12 ಲೀಟರ್ ನೀರು ಹಾಕಿದ್ರೆ ಸಾಕು. ಅದು ನಿಮಗೆ ಆ ಭಸ್ಮ ಎಷ್ಟು ಲೀಟರ್ ಬಂದಿದೆ ಅದಕ್ಕೆ 6 times
ಕನ್ನಡ.
ಇಫ್ ಇಟ್ ಕಮ್ಸ್ 2.5 liters ಭಸ್ಮ, you add 15 liters of water. How much volume is there? 6 times of that water you have to add. Sometimes it may come 3.5 liters also. It is not fixed. How much it comes, 6 times of water should be added, not by kilo. It must be by volumetric, I am saying. That's all.
Okay, so I have prepared Shara, but I didn't got the correct potency. Maybe due to it, I think Abharma Marga may not be dry. But pH is always more than 10. pH becomes more than 10, but while applying, it's not becoming Jambu Balan.
Here, very important thing is, pH is not the criteria for correct Kshara. After applying, it becomes Pakko Jambu Phalavarna is the criteria for the correct Kshara. pH may be 10, 11, it may become Pakko Jambu Phalavarna. pH may 14, it may not do Pakko Jambu Phalavarna at all. So, pH is not the criteria. After applying, it should become Pakko Jambu Phalavarna. So, the best thing to judge is it correct Kshara. After preparing Kshara, you go to mutton shop, freshly cut mutton you take, apply this Kshara. If it becomes Pakko Jambu Phalavarna within Shatamatra Kala, 35 seconds, that's the best method to calculate your Kshara is correct or not. I hope you understand.
Yes, sir, understood.
If it is not burnt Pakko Jambu Phalavarna, you can use that mutton for sambar. It will not waste.
One more question, sir. So whenever we add Chitraga, the Kshara completely becomes brown in color. That whitish color I am not getting. So while adding Krishna Dravya, while adding Chitraga, the Kshara color is becoming brown.
Slightly reduced in color, not brown, slightly. It will become Panduvarna. Not from white, it becomes slightly reduced. Because of Chitraka it happens.
So Chitraga,
not a problem.
Whole plant or root only should be taken?
Only root, and its Khalka Dravya should be taken. Giske, Gandha Khalka should be taken, and then it should be filtered. That's very important.
After taking Khalka, it should be filtered?
Filtered, yeah. Every condition should be filtered. Otherwise, Kshara becomes crystallized. It loses its potency. Potency will reduce.
Okay.
That Khalka should be filtered.
So Shukti also should be?
After adding Shukti also, it should be filtered. Without filtering, don't add anything. Because if you add without filtering, its crystal will come. When crystal comes to the Kshara, it loses its potency if it's crystallized. It should be very smooth, pichila.
Okay.
It will become rough, means it loses its potency. Okay.
So while preparing Shara, in sloga it is told Sudha Sharkara Prakshipya, like that, before burning. In Susruta, Sudha Sharkara should be kept in heap like that.
No, it should be burnt, Red hot should be taken.
Okay.
What nowadays I do is, this limestone powder is available in market. Already pista is available. That should be directly used. Instead of doing all these things, you take limestone powder is available in market. That can be directly added. Instead of making red hot and adding all these things, directly that can be added. ರಸ ದ್ರವ್ಯ ಸಿಗ್ತದಲ್ಲ, ಯಾವುದು ಬಣಪುಗೆ ಅಂತ ಹೇಳೋದು ಅಲ್ಲ, ಈ ಇದುಂಟಲ್ಲ ರೋಸ್ ವುಡ್ ಪ್ಲ್ಯಾಂಟ್ ಉಂಟಲ್ಲ, ರೋಸ್ ವುಡ್, ಅದರ ಸಪ್ಪಿದ್ದು ಕೂಡ ಪಿಚ್ಚ ಸಿಗ್ತದೆ, ಅದನ್ನು ಯೂಸ್ ಮಾಡ್ಬೋದು. ಸಿಗ್ತದೆ, ಇದರಲ್ಲಿ ಸಿಗ್ತದೆ, ಸ್ವಲ್ಪ ಕಾಡಿಗೆ ಸಿಗ್ತದೆ.